So I'll take a couple of minutes in introducing Dr. Gokral, who is the speaker for today's session. So today's topic on which Dr. Gokral is speaking is women's health from womb to tomb. It is an important topic, not only for women, but also for men to understand about women's health. Dr. Sudhir Gokral stays in 8 Hour. He is a practicing obstetrician and gynecologist for the past 50 odd years. He's a senior gynecologist at Global Hospital, Beach Candy and Somaya Hospitals. He's an MD, DGO from TN Medical College and ex-assistant professor from Nair Hospital. He has presented papers at various regional and national and world conferences. And he's on the faculty of Johnson & Johnson and conducted various workshops. His wife, Dr. Jyotsna, herself also a gynecologist, is a retired deputy director ICMR. And in his family, his son is working with ICICI Bank and a daughter-in-law with the Society General Bank. So with this introduction, I'll request Dr. Gokral to start his session, please. Yeah, Dr. Gokral, you can share your presentation.
Okay. My face I can see. Yeah. Share. In 1 minute. Hello, good morning. I hope you all can hear me.
Yes, doctor.
Yes. Thank you, Mr. Ali Ladda, for giving me this opportunity to participate in today's lecture. And I'll be very glad to talk on this topic of women, which is very much a neglected topic. And be surprised to know that of the population that we have about 45 to 50% of our women, and yet we are not paid much attention to their health. And therefore, I feel that I could start talking on this issue right from the beginning to the end, and how we are concerned with the health of the women as gynecologists. So today's is not a lecture on the subject, but it is a conversation and dialogue with the women, how to go about it. I can't see myself. This one. This is what I'm facing. This one. So today's topic will be on the birth of the baby, and we as obstetricians and gynecologists are involved very much in the delivery of women. So I'm going to start from the birth of the baby and then go further down till the senior age of the women. Now, the topic which I'm topic on is something which you don't have the audience in front of you, and being a topic of public interest, it will be very difficult. It had been difficult for me to formulate my talk because I have to use the words very carefully. Secondly, it's a topic concerning women. Therefore, I will not be having any pictorial images to show, obviously. Therefore, whatever I can tell you, it's not a subject discussing gynecology or obstetrics, but a subject discussing and making people aware as to what they should do in their lifetime, what are the markers and signals which they should be aware, and secondly, how the whole family should be involved in this part of the woman's life, which is, I feel, in much areas is neglected. And secondly, it is also not the awareness amongst the people too. And thirdly, that they are not bothered to find out, or people or doctors have also not been able to explain to the patients what is the importance of women's health. So let's we start with the birth of the baby. and that's the delivery which we do. It can two ways a woman can deliver. It's either normal or by cesarean. Most of the time, we strive to see that the woman delivers normally. And if you see, just to also give you a perspective, what happens in the labor room, we are on extremely on high alert because we have to have the cooperation of the woman to deliver this baby safely and soundly and within a reasonable period of time. And therefore, it's very important to be concentrating and getting the help from all sides. Therefore, we have a team inside the labor room. And the word, many people do not know what obstetrician means. And obstetrician means, and in Latin, is accoucheur, which means a person is standing in front of the woman to take care, to pick the baby up or to deliver the baby. And therefore, he's almost like a wicketkeeper, like MS Dhoni, donned and gloved up, waiting to deliver this woman. Most of the times, now people don't understand that normal delivery is a very simple affair, that the woman gets contractions and the baby is just born out just like butter. Far from it. You realize that if you understand the anatomy of the woman, she has soft tissue structures and she has bony structures. Now this newborn, which is what you call as a fetus, is inside the uterine cavity, surrounded by a bubble of water, what is called bag of waters. And this, when it ruptures, the uterus contracts very strongly with her aid, and this baby is pushed down this passage. Now, mind you, you have to understand that this passage is not a simple, straightforward passage. This passage is fraught with many curves and turns, and the baby's position also is equally important, and the pushing of the baby down into the vagina. Therefore, if we cannot say for sure, and when people think, doctor, will my wife or will deliver, my daughter will deliver normally, it is extremely difficult to say for any gynecologist of any repute, because the delivery is of every woman is not a science, because this passage is not like a straightforward tunnel where the baby enters and comes out from the other end. It is the passage which has many changes which takes place, and therefore this baby has to mold itself to come out, and we have to wait and watch throughout to see how this baby manages to come its way. Therefore, it is very important to understand for the layman that it is a dynamic process, and this dynamic process is changes from woman to woman and changes from the same woman where every time she gets pregnant. Therefore, it's important to understand that one cannot make a hardline decision at any point of time. In fact, if you talk to the gynecologist, you'll tell a senior most or a good one will tell you it is an art and not a science. And however good you are at it, and you may have mastered thousands of deliveries, but every delivery is a challenging task the layman must understand. Therefore, we are in a very high tension zone, and you're trying to get the best to get the baby out of the rhythm on time. The same picture changes when you cannot deliver the woman normally for various reasons. Maybe the baby is too big, passage is too small, the bony structure is not proper, or the baby is lying not in a proper way, or horizontally instead of vertically. Then you deliver the woman by a cesarean section. And this delivery is done in the theater, mind you, with the whole team and the anesthetist. And this is the preparation which you do. Either you plan the surgery, which is called elective surgery, or you are taken as an emergency, whatever the problem is, maybe in the mother or in the baby. So when the baby is born, what we do is we lift the baby up and turn it upside down and give it a whack on its backside or on its buttocks so that it cries. And the biggest part is, the funniest part is that when the babies cry loudly and lustily, we laugh because we are happy that this baby has delivered normally, because the purpose is that when the baby cries loudly, the gulp of oxygen gets into the lungs and the baby becomes pink. You see that this is a newborn baby picture which I put forward to you. It has got the hands or if you see the fingers, they are still bluish. That means the oxygen has not yet reached there. But after some time, the oxygen reached there to the baby. Now, then what happens? When the woman has given birth to this baby, she becomes a mother. I don't know how many of you may have seen, if you're going from Mahim towards the airport and you cross the 16th Stephen's Church, the next signal which you come, there's a flyover. On the left side, there's an image made by Mr. Madhav Kamath. This is just a replica which I got. And I love this statement where a woman, when she was a child, she was an adolescent, she was a teenager, And now when she delivered, she became a mother. And what a beautiful sentence that she has put it, that a child gives birth to a mother. So the whole dramatic change takes place in the lady, which I think everybody has to understand. And this is the multifaceted personality, a woman, which we all have to understand. And the changes which are seen are much more dramatic and different. And you find the same woman is not the same every time. Now the newborn is there. Formerly with older times, we had a pediatrician looking after the baby. Now we have specialists called neonatologists. They take care of the baby, and to see first, when we deliver the baby, we see it is normal. He identifies, sees all the organs, whatever you can see clinically from externally. At the same time, when you have malformation in the baby, you at least are aware that these are the problems which are there in the child, and you address it by going to the respective departments. What is more important, I want to tell the women who have become mothers, is that breastfeeding is a must for 6 months. I know in the urban living, it's very difficult, but I know most of the women, what my patients do is that they don't take leave till the end. They take the last few days of leave, and they spend the next other 6 months breastfeeding, which is a wonderful thing. Because you're going to give antibodies to the baby, prevent it from infections, and a good, healthy nutrition available naturally to the baby. Where otherwise, you put them on top feeds and on powders, I would not really recommend unless you are forced to. Now, once the baby is born, and now I don't get to see them at all, that's not my domain. Now they grow through a period of time, they are with their parents, and their growth has to be very well monitored by the parents. And my advice or request to the parents is that from the birth till they reach 12 to 13 years of age, if good care is taken regarding their nutrition, their diet, their habits, this child or a toddler will grow into a wonderful, normal, physical, mental human being, which makes life easier for the child for the future role which he has to play. Therefore, it is not, we tend to pamper them, we tend to give them the wrong foods, and diet is extremely important when you see in children, where you try to give them the most natural diet of nutrition of proteins, carbohydrates, and fats, well-balanced diet, so that these children grow up well. And more important is see that you give them iron during this phase of growth along with calcium, because this has a bearing when they come to me later on in puberty. Puberty is, when we will not be knowing, it is the onset of periods. It is a very frightening situation for the girl at that point of time. So the best friend of this girl will be her mother. So it's very important that a dialogue has to be maintained in this growing period between the mother and the daughter, so that the child is free to talk to her. At the same time, the mother must explain to the child what is period, because it's very frightening to the child when she sees the first spot of blood. And sometimes it can be more normal, sometimes it can be very heavy. So awareness and education and guidance make their life very easier. You have to explain to them about the sexual hygiene. And in fact, we have wonderful movements in India. In fact, our Gynaecologist Society also has what we call talking about sterile pads to the children, to the slum dwellers, to the people. And we, in the north, in Uttarakhand, we have what is known as a proud movement, where women are doing exemplary job in explaining to the girls and the kids about the use of pads. And in fact, the government has also been involved. So this biological clock, which changes with time, the girl begins to grow physically. Her physical development starts as well as the mental development. And these changes are to be made to be transitional, to be very smooth and nice for the girl. The important points we face in the children is that they have painful periods. And we don't seem to bother, because sometimes every 5 days of the month, the child misses school. And these painful periods can be very severe. Sometimes the child rolls on the floor, and sometimes they get severe vomiting. So that has to be attended to by simple diet, exploration, and exercises. At the same time, then if it is still not manageable, then probably the gynecologist will step in and guide you accordingly. Therefore, we find the transition in a woman's life. If menarche is the beginning of the periods, then she goes through the pregnancy, and later on through the menopause. So there's a whole cycle and lifestyle which the woman goes through, and we have to understand the various changes which takes place in this woman. But I cannot talk to you of all the changes which take place, all the diseases there in today's 45 minutes of talk. But I thought what common problems I face in my practice, and what common problems women face and come to me, which is very commonly seen. Some of them I have picked up, and one of them is the polycystic ovarian syndrome, which you see most of the women coming to the clinic who are office going, who are executives, or generally it's a mother who gets a daughter who is 16-year-old saying that does she have a PCOD? What are the complaints? She has irregular, scanty periods or absence of periods. She says for 2 to 3 months she doesn't get the periods at all, or they were 4 days earlier and now they become hardly 2 to 3 days. Another important part is the weight gain. Many times the mothers tell you, daughter, my daughter is not eating so much as you think. She's not on fats or on junk food, but yes, she's just putting on weight. It's a fact. This is a hormonal imbalance. And this hormonal imbalance brings about obesity or weight gain, especially around the waist and the hips. Another factor which has is the excessive hair growth. It is embarrassing for a girl who is about 17, 18, having a hair growth excessive on the upper lip or on like a sideburns or a coarse hair almost like the males. And that becomes a bit embarrassing for the girl. So when they come with these problems and with mood changes, we find that we have to diagnose by various methods of ultrasound and hormonal preparations, investigations, and come to a proper diagnosis. And the women who come later on, because if you don't treat this at a time when they are not married, they have problems. They may develop later on diabetes in future. And the basic problem with the polycystic ovarian syndrome is that it does not bring about the ovulation or egg production, and therefore they go into problems of infertility. That becomes totally a different game to play with, because that is the thing where the doctors go to detail, work up, study, find out the treatment to this lady, whether she's married, that she's come for childbearing, or a girl who's come to get a regular periods. So you rectify and correct these things and they'll be fine. The bottom line, which we as citizens must remember, that when a girl comes with a polycystic ovarian syndrome, whatever the doctors will prescribe to you, it may be hormone treatment or surgical treatment, whatever it may be, most important thing we should know, you must get down that weight of the person. So to get down the weight of the person is mainly due to by exercises, diet control, and which you have people who guide you on that, which is beyond the scope of my talk today. Now we come to the girl who has got married or has gone to the reproductive age group. And this age group is a very huge age group, which starts almost from the start is ovulation till they go into menopause. Now people should be aware what is known as premarital counseling and genetic counseling. There are couples who are young, who get married or who are going to get married, and they have no concept of what they're entering into, some of them. Therefore, it's very important to go, it's nothing to be shy about, but if you have no knowledge about sexuality or of your human anatomy or what is sexual relationship, you should contact your doctor or you go to a counselor. Now, this premarital counseling gives you a good idea as to how to go about leading your married life. And there are some people who have genetic problems, who have hereditary diseases like hemophilia or transmissible diseases, which are inherent in the family. And so if you're aware of those things, you can take precautionary steps or measures to control it and be aware of it. Therefore, many times patients come to me, ask us that, doctor, we are getting married in 3 days' time, and what to do, what contraception to follow. I think that's too late a time when a doctor can really help you much, except they probably can advise you to use a condom. But if you come 2 to 3 months earlier, we can advise you certain medications or the contraceptive pills, which take 2 to 3 months to act, and they can give a better contraception and prevent the pregnancy. Because nowadays couples don't want pregnancy for 2 years or 3 years as the trend of late, and therefore better to prevent it rather than land up with the pregnancy and get it removed. Therefore, we have contraceptive methods, mainly the condom, the intrauterine contraceptive devices like the Puberty, and the contraceptive pills. If you come from up downwards, the highest failure rate is in the condom, though it's used as properly as you can. Intrauterine contraceptive devices are like Puberty, which we insert in the uterine cavity. So this is reserved for women who want to space the children. Say they want to have a second child after 2 years or so, we generally advise them. This contraceptive devices are going to disrepute by the public, because if somebody tells you that I have heavy periods, it's not suiting me, it's painful, then the whole contraceptive device gets a bad name. It is not true. We have to, it's like you going to a shop and you buying a shirt for yourself. Obviously, one size doesn't fit all. Therefore, if you find that you have inserted a copper T and you find it's not suiting you, go to the doctor, he'll tailor make that copper T for you and he'll try it out. If it really doesn't suit you or it's not having complications, you can always get it removed and go to other method. The third thing I want to come to is the pills. The pills are safe. They give a very good, almost 90 to 95% protection from pregnancy, but you have to take pills with the recommendation of your gynecologist. Because many people I find go down to the chemist. The chemist is very willing to help them. He dishes out the pills to them, and you don't know what pills is given with them. Host of pills in the market of various combinations of various strengths. So what suits you may not be right. But before you go on to the pill, it's very important you discuss your problems and go to say recommend ask the doctor that he has to recommend the right type of pill. And before he recommends that to you, he will go into your history in detail. So you don't have problems of blood clots and heart disease or breast cancer in the family, then you can take it. Otherwise, you should not go into the pill unless your doctor advises you. Now, the next topic which we come to is that if your pills have failed, you have any of your contraceptive methods have failed, then you land up with a pregnancy. Now, pregnancy is an area which is a really bothering thing for all of us. In fact, when 1971, the government of India passed, we have what is known as the MTP bill, Medical Termination of Pregnancy Act. Before that, abortions were absolutely done by quacks and many other people, and we had a lot of complications. And in 72, it became a MTP bill, where women can go to a safe place, a recognized place by a recognized doctor with proper asepsis and in less infection, you perform the abortion. Now, one must be aware that if you want to get an abortion, the rules are very clear cut. You can do an abortion by surgical procedure or by medical procedure in the first 12 weeks of pregnancy. After 12 weeks to 20 weeks, there are more difficult methods of terminating the pregnancy. And be very, very clear about it that you will not be allowed and you should not get it done. And no gynecologist should do any termination of pregnancy beyond 20 weeks. It is absolutely illegal. And therefore, one should not get on this. I know today now the government has also increased it to 24 weeks, where there's very special reasons of like a malformed baby or whatever the reasons are. But please do not ask for an abortion beyond 20 weeks. And still, I would say go one step further, that ask for abortions as early as possible if you need it. It's not something, it's not a method of contraception that every time you get pregnant, you get it yourself cleaned up. No, that is not the way to go about it. You have to understand that abortion is not a good affair at all. I would not like to do it, and I don't do any of those abortion, what you call as the beyond 12 weeks to 20 weeks. It is something which really one doesn't like to do it. And if you see the woman also, she's not liking it either. But sometimes she's by compulsion, she gets it done. And people think, now nowadays we have these tablets. Earlier pregnancy, you go in for an abortion. Say, for example, a woman has missed a period, few days over, she feels she's confirmed a pregnancy test, and she goes to the counter of a chemist shop and picks up those 2 pills and starts taking it. Do not ever make that mistake, because these pills are of one is to be given immediately and one to be given 48 hours later. And you then abort as like a normal period. But it is fraught with danger, because if you are not sure where the pregnancy is, you will be in deep trouble. Because you have to wait. I would advise you, if you have missed a period and you're thinking you are pregnant, then if your pregnancy is confirmed, please confirm this pregnancy through your ultrasound, where the pregnancy should be lodged in the uterine cavity. If the pregnancy is not in the uterine cavity, it can be lodged in the fallopian tube, what is known as an ectopic pregnancy, and that can be a very dangerous situation, and that can be a situation which could be life-threatening. So please, once you're confirmed it is inside the uterine cavity, you can go ahead with the pills, but again, under the supervision of your gynecologist. When a patient comes for an abortion to us, and we prescribe them these 2 pills, it's very simple. But remember, we are on the radar all the time, wherever she is, because it may simply end up 95% beautifully with no problem, but 2 or 3% of the cases will land up with heavy bleeding, and where you have to tell the patient that you may have to undergo a DNC under anesthesia. And any procedure, anesthesia or otherwise, is not a simple procedure. Let me tell you that, because patients tell us, Doctor, is it very safe? 100% can you guarantee? No doctor can give guarantee regarding the surgical procedure, however big or however small it is. Because if you go for a day, people think they leave the homes. I get these girls or women who are aborting, they don't tell the family for whatever reasons, and they come to the hospital, they get it done, and they go home as if nothing has happened. You will escape most of the times, but sometimes you'll have a problem of anesthesia, and you have a complication of the procedure. It's a blind procedure, and you can land up in a severe trouble. Therefore, involve the family members and get it done, not an issue at all. Because to for simple anesthesia, to give a very simple example of what happened a month ago, Joe Biden, who is the president of the United States, underwent a simple procedure of colonoscopy where a telescope with lens is inserted in the rectum, and they do a routine screening procedure to see for polyps or for cancer, rectal cancer. That's the standard method in America. But in that period of time of 40-45 minutes, Kamala Harris was the president of the United States. Why? Because anything could go wrong in the anesthesia or in the procedure. They would not take a chance in case unfortunate thing would have happened. Then there would not be a vacuum in the position. And that is why it's important to understand that no procedure is simple. Again, the due date of pregnancy when women come to us, I would advise women that when they are pregnant, go as early as possible to your doctor. Because that's very important to get to know your pregnancy is proper, which is normal, get the investigations done, and know your due date, so roughly know what time or which time around you're going to deliver. The people should be there, the hospital should be around where you're going to go in for delivery, and the doctor should be aware. It should not be your obstetrician looked after you for 9 months and suddenly disappeared on the radar. And then you get into a flap as to where my doctor is. That should not occur. So I should also know, or the doctor should also know, that so and so patient is going to come around this time. So we are also very vigilant and aware, because nobody likes to have a doctor who looks after them for 9 months, goes abroad at the time of delivery and hands it over to his colleague, because the faith is developed in the patient, the doctor-patient relationship is a trust and an understanding, which I think is very important. And at this point of time, patient also feels extremely nervous. So therefore, the delivery, which I'm talking of the real importance, is when you go in the antenatal period, that is the pregnancy time from missing the period to delivery, the important things which a patient must understand is go for regular checkups. See that you get your hemoglobin done, which is important. You see that your urine examination and your no swelling and your blood pressure. If these things are under well control, and the baby's movements are very important for you, because if anything goes haywire in this, especially if the blood pressure shoots up, they have something what is known as fits or eclampsia of pregnancy, and that can be a very dangerous situation, which leads to morbidity and mortality. Therefore, and second is a cesarean section. If they had to, you can plan your cesarean section, or you can generally a good gynecologist is one who will decide to do a cesarean section only when it's pushed to the wall. When either the child's life is in danger or the mother's life is in danger, he does a cesarean. I know there are black sheep in my profession who do unnecessary. That's where I get hammered every time. That doctors are doing unnecessary cesareans. But it's not true many times, but it is true also. Because now the safety is more important. And let's be frank, that we are doing a bit of a defensive medicine. Because there may be not an indication, but yet we do because we don't want to have the complications. And they feel cesarean is very safe and easy. Sometimes patients demand a cesarean. That's what they do in foreign countries. And I don't think I follow that practice, because I don't believe in demand, because I believe only if it's indicated. And that's what we are taught in medicine when we learn our post-graduation. So a second is another demand which they make is that my Guruji or my Brahmin has said at this point of time, this baby must come out. Probably might become Einstein or what, I do not know, or it will become a mutt. But the point is they want this fellow to born. How do you decide the time of the birth? Whether the baby is coming out, the baby is cried, the baby is not cried, is a debatable issue. The most important part I'm now coming down is to menopause. This is the area which is completely neglected by people, where the woman has at 40-45 years age has a cessation of her periods. This is the area which I thought I should emphasize more, because people are not have taken for granted that this woman at 40, 45 is going to miss her periods. Everything is done now, everything is over, and the children have become big, they're gone, they're working or they've flown out, and she's also now more or less relaxed as the family is concerned, and therefore she takes a back seat. And this back seat is accepted and taken for granted by the men folk, which is not very true and not very correct. And therefore, at this point of 40, 45 years, where there's a vacuum in the woman's life, there's a sort of a feeling that she's not a very attractive lady who is not very much in, was not the central figure as was shown in the earlier times. So there she takes given the back seat. Therefore, this is a time which I would like to concentrate more on the women. Therefore, I think menopause is a very, very important subject which we have neglected. In fact, we have an Indian Menopause Society, we have an International Menopause Society also, and we are very, very active in these areas. And but awareness and education of not only the female but also the male to understand their problems, what they are facing to is important. So the estimated mean age of menopause is around 46 years in India, and it's a much more 50-55 in the Caucasians. So these are all studies done. What is the definition of menopause? It is 12 months of absence of periods. It is retrospective diagnosis. Mainly the hormone, the ovarian hormone becomes very less because the follicles which produce the egg are becoming less. So there's no marker for that. At the same time, there's no need to conduct any test routinely to diagnose the menopause. You don't have to go to the doctor and say, doctor, why do I have menopause or not? 1 year of missing of the periods, you really need to, there are certain tests we do, like a history. We see the signs of vaginal pH and lateral vaginal smear. And if you really want to know, you give them hormones, estrogen, progesterone, and see for withdrawal bleeding. If there's no bleeding, most probably you're going into a menopause. Now, certain issues which take place in the postmenopausal, I'm not going to go on the topic of diabetes and hypertension. This is handled by the respective disciplines. But I'm concerned with my discipline of what women can come with. And we people take it very lightly. The postmenopausal bleeding is the occurrence of vaginal bleeding following a woman's final menstrual cycle and is not on cyclical hormonal therapy. But any vaginal bleeding 6 months after cessation of the period should be considered suspicious and warrants investigations. If it's very important that you visit your doctor and let him do a thorough checkup and find out what the cause is. Now, this is a nice slide to show you about the changes that take place at menopause. Now, people don't complain or talk about it. It's taken for granted, which is quite wrong. Therefore, what are the changes that this transitory phase which takes place? They have hot flashes, night sweats, and these hot flashes and night sweats are not something to be ignored. I do get patients who are terribly disturbed that they really get severe hot flashes on the face, on the limbs, on the chest, and thereafter they put on the AC and immediately start feeling sweats. And in fact, your sheets are so wet, that much of sweating, so it's very disturbing to the period. The changes of periods, we know that. And there's a weight gain. The problems with the bladder, which are again neglected. Most of the people in the old age, in 60s and 70s, do not have control over urine, and sometimes they leak when they laugh or they cough, and that is sometimes can be a bit of an embarrassing to the patient. Vaginal dryness, cause which leads to infections, loss of interest in sex, sleep disturbances, forgetfulness and headache, loss of hair on the hair and chin, muscle and joint pains, and hypertension. These are the problems which they face, and these are things I think we should attend to. When a woman goes to the health checkup clinic, she does all these tests, mind you, routine, which you all of you, I'm sure, are aware of it. That you get your blood test done, you get everything done. You are then sent to the respective departments. You have a particular problem where it's concerning. But nobody attends to the woman at menopause to talk to her in toto and in detail. And these are your problems, and we have to listen to that. This is a beautiful slide which I always liked it. And we always hold this: a woman is a gift of nature. I would not use the word old woman, and she is a work of art. Therefore, a lady in her 60s and 70s should look and feel good. And why should she feel that she's done everything in life and now should she take a back seat and be like a piece of furniture? Sorry, she has to feel as good as her younger one. So most important in the age group of menopause is the diet. You have to have calcium and vitamin D. and have roughly an idea of 300 milligrams of calcium are available in 1 glass of milk or 2 katoris of curds. Non-dietary will provide you about 200 to 300 milligrams of iron. This is the most important aspect which I want to talk about, which is the most neglected, is osteoporosis. What is osteoporosis? It is porous bones. It is a silent disease. Many don't realize it, and 80% are still not diagnosed. And how does it help? After 20 years, bones develop called the peak bone mass, and old bones constantly replaced by a new bone. In osteoporosis, more bone is lost and not replaced. Fractures appear at the hip, the spine, and the wrist. This leads to long-term disability and loss of independence. Therefore, 1 in 4 with spine fracture will get it again in 1 year. Please, this is extremely important. We have to understand that and not take it for granted that as long as you're walking here and there, everything is hunky-dory. After a hip fracture, 1/4 will never walk again. So 1/4 of the people will never walk again. The recommendation of DEXA. So therefore, we do, to find out osteoporosis, we do a test what is known as a DEXA scan. This is the scanning of the bones, only specifically to see if your bones are normal and healthy and strong, or are they porous, or they are very easy to break. So who should go to undergo DEXA? All the major hospitals in Mumbai have this DEXA facility, and we are lucky enough. We have Global Hospital across the road, and we have a wonderful machine. As a standard, it's a gold standard to follow to diagnose osteoporosis. So all women 5 years beyond the age of natural menopause must get their DEXA done. Women less than 5 years since menopause with a particular factor, like they want steroids or those on cancer drugs, should get done earlier. Women with fragility fractures, what does it mean? Fragility means normally if you hit yourself against a structure, you will not fracture your bones. But here a slight fall or just hit on the chair or fall from the chair leads to fractures that you would get really worried about. The women in menopause transition with secondary causes. Then radiological evidence of osteopenia. Osteopenia is one stage before osteoporosis and presence of vertebral compression fractures. When women have compression fracture of the vertebra or the spine, or a woman you find that she was of a good height earlier, but now she's looking short of 1.5 inches. Please think of osteoporosis. And before initiating any pharmacotherapy for osteoporosis, suppose you have diagnosed a person with osteoporosis, your orthopedic surgeon or doctor prescribes you medicines, then before you start the medications, you have to get your DEXA done. And the internal testing should be based on calculated individual risk and maybe between 1 and 5 years. So the few facts you must know: fractures after 45 years leads to more days in hospital than heart disease, diabetes, and breast cancer, which people don't know. Up to 20 to 24% die in the first year of hip fracture. Hip fracture experience loss of independence with 40% unable to do their jobs independently. 60% require help. 80% have small activity restrictions like shopping, driving, etc. 35% are totally dependent after hip fracture. Therefore, fracture not only affects you physically, but also emotionally, lowers the quality of life, brings about depression and isolation, as there is very little social interaction. Therefore, true strength comes from taking charge of your health. Take care of yourself, don't depend on others. I'll just skip the slide. This for breast cancer is another domain which you have to be very careful and be aware. I'll talk to it a bit in detail. Cervical cancer. These are the highest number of cancer disease in India is breast cancer, number 1. And number 2 is cervical cancer. Cervical means the mouth of the uterus. All these diseases are now, unfortunately, the reproductive system in a woman is internal. It's not something which you can see. You see a lump on your finger or you see a bone fracture, you can see it. In cases of the cervix, it is inside. So you have to be aware of certain warning signals which give you. Therefore, since they are not aware, we have found out a cervical cancer, according to GloboCan 2020, is the second leading cause of cancer among women in India. So very, very high figure. The incidence is about 18.3%. 1,23,000 new cases are added every year, which contributes to 25.5% of global incidence. So 1/4 of the world, we are providing the cervical cancer. So 22.6% of the global mortality or death due to cervical cancer is attributed to India. So cervical screening is the most important part which women try to avoid. So if you get your screening done, you do what is known as the pap smear, you have found yourself disease in a very, very early process. And this we can help you have a better quality of life than coming much later in life with great burden on the society, on the family, on the patient herself, and the 5-year survival rates also get very poor. Therefore, the burden of cervical cancer is not reduced due to several factors: absence of organized screening programs, inadequate infrastructure, and lack of political will. Therefore, due to low awareness and poor health-seeking behavior, the government of India has formulated an operational framework for systematic population-wide screening and management. So earlier, people used to come for pap smear screening in the cities. Now we have spread the network right to the tier 2 towns and cities and villages also. And hopefully, you'll be surprised in America that when they were not doing the pap smear, there were very, very high incidence of cancer cervix. But once they started screening regularly in women, it dropped down dramatically. So we have to get our women to get to this pap smear, which generally I noticed avoid in our health checkup clinics. So what do you assess in a clinical examination of the woman? You see the height, the weight, the blood pressure, the cardiovascular system. Do the pap smear examination, which is just like we cannot show you the pictures, but it's very similar to what you do when you depress the tongue and you see the tonsil hanging out there, or that is something like the cervix. You just take a swab stick and take a smear of that, mount it on a slide, and send it to the pathologist, who will see the cells which appear normal or abnormal in a very, very early stage. And then you can investigate further if there's a problem. Breast examination, thyroid examination, waist circumference, physical fitness, see the mood and the cognition behavior of the person. Eye checkup is very important, refractive index and retina, and dental checkup. So the lab test will be complete picture, urine test, blood sugar levels, lipid profile for fat, serum thyroid levels, pap smear. Transvaginal ultrasound is extremely important, where you find out the diseases like the fibroids, cancer of the uterus, or cancer of the ovaries, which is a very, very silently growing disease. And we are caught on the wrong foot many times. So just do a regular transvaginal ultrasound, everything is fine, you don't have to worry. Mammogram is for the breast tissue, and this is the highest killer. So mammogram should be done. People avoid it, please do not do that. And obviously DEXA, which I'll explain to you. So a health checkup at the menopause clinic, if you start, will be the height, the weight, and the breast examination. Now the breast examination can be done at home. We have what is known as a self-examination of the breast. The woman should stand in front of the mirror once in a month and see the breast size, the equality, are the equivalent dimensions, is the nipple centrally placed, and you divide the breast arbitrarily into 4 quadrants. And not with the tips of your finger, but with the palm of your hand, palpate on the 4 quadrants and see if any lumps or bumps or hardness or firmness, and go right up to the armpit, because the nodes will be there. So this is the earliest way of diagnosing breast cancer, and more importantly also, press the nipple to see for any discharge. It is watery discharge, blood clot discharge, or it is pus, whatever. So blood pressure, your routine blood test. This is how we do the pap smear. And the bone mineral density is a very simple test. There's no invasive procedure involved. And finally, the ultrasonography. So we have 18th October as a World Menopause Day, where we make people aware. And October is the World Menopause Month. But here we have talked only of the physical aspects. What we do not see in a health checkup is the anxiety, the mental status of the woman, what she's going through. And as she gets older and older, we don't seem to bother. So we have a wonderful mantra by the Indian Menopause Society, that the women mantra is, you have to be fit at 40, you have to be strong at 60, and independent 80. And this is a wonderful slogan which I think we should all remember, because any of these things we do will be fit and fine for the future and not depend on others. Because I find when we all suffer, or the women beyond 60 suffer from the emptiness syndrome. They are alone, they are lonely. And when I see my patients, when they come, the elderly ladies, there's hunger in their eyes that somebody should talk to them. It's very important that the doctor should talk to them. And this is a lovely quote which I like. The greatest mistake in the treatment of disease is that there are 2 physicians one for the body and one for the soul. And although the two cannot be separate, which Plato said it centuries ago. Therefore, we doctors have also made big blunders in the sense of deficit with the patient and the ourselves. We have not been enough to go forward and listen to their stories, however boring it may appear. And more importantly, it is not the woman who has a uterus, you go to a gynec, you have an eye problem, you go to an ophthalm, or you have a bone problem, you go to an orthopedic. A doctor, a good one, should see the patient as a whole. So it is not only the physical, the anxiety, the nervousness, the problem which they face. So a health checkup clinic cannot do that. But you just have to have a menopause clinic, which you have enough time to spend with them, talk to them, smile to them, give a patient hearing, and you'll find they will be very, very happy because somebody is there to listen to them. Sometimes the family members also don't listen. The family members, the husbands should, or the male factor should encourage. Sit with your mothers or your mothers-in-law and talk to them for 10 minutes. 15, you cannot say this today's world of rat race. We are all very busy. Who's not busy? Then if you have these work from home people who get into the laptop in the 8 o'clock in the morning, come out at 10 o'clock at night. And then the old elder people are just sitting looking out of the windows. It's a sad state of affairs. So you have to make time, quality time with your family members, sit with the elderly people, talk to them. However inane or topic they're talking may not be relevant to you, just hold on, listen. Many times I go out to the market and once you find out I'm a doctor, the elderly women want to talk to me something about the family, maybe about the disease or maybe about the daughter-in-law, whatever, you listen. But when they unburden themselves, they feel nice and happy. And especially the grandchildren should be encouraged to be with the grandmothers so that everything goes well. And finally, I will end my talk with this beautiful picture of don't let menopause pause your life. Thank you very much for hearing me on a Sunday morning. Thank you.
So thanks a lot, doctor. Thanks a lot. This was a very informative talk. I am sure audience must have found it knowledge increasing for themselves. So with this, I open the session for Q&A. Any questions, any discussion points, any of you want to raise, please unmute yourself and please ask. Or it would be helpful if you can raise your hand so we can go one by one also, if that is okay. And doctor, you can stop sharing the screen if you like, so that we can see the audience. Yeah, I would request you to raise your hand in the sense there is a raising there, or you can open your video and or otherwise you can start talking, whichever way, it's fine.
Yeah, so maybe I'll start. So Doctor, yeah. Thank you very much. I think very, very important topic.
Thank you.
Much ignored. So thank you very much. I had a question that, some few years back, I heard something or read something about a cervical cancer vaccine.
Yes.
Could you educate on us?
Yeah, I would like to talk about that. Because of the constraints of time. We have this, when people are sexually active, there's an infection which is transmitted from the couple. That's a sexually transmitted disease. And one of them is a virus, or is known as the Human Papillomavirus. This virus attacks the cervix at a very early age and brings about changes in the cells of the cervix. There's mainly the virus 16 and 18. They bring about change in the cells and make them precancerous and cancerous. Therefore, to prevent the person from getting this problem, these vaccines are available in the market called Cervarix and Gardasil. And we ideally should be giving it to the girl before she becomes sexually active. If around, say from the age of 9 to 25, the vaccine should be given, and each vaccine has its own regimen to be given. And when we give, now the issue is many people have not come to any proper conclusion whether it should be given as a matter of routine. So some people would not want to give as routine, but ideally, if you ask me personally, I think one should give at that age group. Afterwards, giving when exposed to the virus or exposed to the change in the cells, it won't really make much of a difference. It won't matter much. So if you have to give the vaccination, give it to the girls after age of 19 to 25.
there is only one vaccine, is it, doctor, or there are choices?
There are choice of two. One is the Gardasil and one is the Cervarix. Going by two different companies, and you have to give her 3 doses, and their details of the type of vaccine they are. So they're more or less the same. So it depends on what they're available, and you can give them. We do give to some of our patients. And sometimes we do, when we do a pap smear, they also sometimes laboratories tell you to do your HPV testing also. So you get an idea that you're not really finding out the cells which are pre-malignant, but you're also trying to see whether the virus is a causative factor.
Thank you, doctor.
Can I ask you a question, sir?
Yeah, sure.
Okay, I just want to ask you, can you share this recording with us?
I think the recording will be given by Anil Ladha to everybody.
Yeah, so this recording of this session will be uploaded on the YouTube video. Are you from Ashok Tower or you are not from Ashok Tower?
No, I am talking from Bangalore.
Okay, so see, there will be a YouTube link will be there, which I'll share.
Okay,
I don't know if you can let me know in chat, if you can let me know your number, I can forward that link specifically to you as well.
Sure, I'll do that. Thank you.
Any other questions? Anybody would like to raise any discussion point?
So, doctor, for women in menopause, there seems to be a recommendation to take a calcium, tablet every day.
Yes.
You had, put up a slide which said 2 bowls of dahi, etc. Right? So, of course, calcium is required, but do the tablets help? Is that something you'd recommend?
Oh yes, why not? They definitely help because calcium is the most important ingredient for the bone formation. And earlier, before menopause, women had the estrogen hormone which gave that help to form the bone stronger. Now in menopause, when this has gone away, we require something for a bone formation. It's a dynamic process of here the bone formation is less, but the bone destruction is more. But to supplement that, only calcium is not essential, but you also require to have vitamin D. And vitamin D is available through the sunlight. And the ideal time to be is in the sun between 9 and 12 in the morning. And that's the best time one can get your skin exposed. And moreover, if you realize, we are dark-skinned people. And we don't absorb as much of vitamin D as the fair-skinned people in the Western world. Therefore, we have to expose ourselves more to the sunlight. Take vitamin. If you don't have that much, now you find people who are most of them are indoors. The working ladies, they hardly step out, or the ladies don't step. The girls don't step out. Therefore, you have to supplement them with vitamin D3, roughly about 60,000 units per month, and always get your routine checkup in menopause. Please get your vitamin D, calcium, and parathyroid hormone levels done. When these 3 hormones are done, you get an idea, and plus your DEXA, you know what is the status of your bone. So you can take precautionary methods, but more important than that would be also to do your exercises, which are load-bearing exercises. You have to strengthen the bone as well as the muscle. You have the bones which are weak and the muscles will not be able to hold that, you will end up with fractures. Therefore, it's really important to not only walking is the best form, obviously, but you have to do some strength weight bearing exercise, and you have to go to a good physiotherapist, I would say, and not to the trainers. I'm not very particularly fond of trainers because I've tested them. The knowledge is not very good. Sometimes they recommend, especially for the elderly people. Well, the youngsters can go and take the exercises in whatever strength form they want. But the elderly people have to be very careful of your ligaments, your bones, and you will end up with fractures or a disc prolapse. So it's ideally a physiotherapist who is well trained with the anatomy of the bones and the skeletal structure is the right person to guide you. For example, for us, I would not go to because sometimes they have these group classes, which I noticed, 30, 40 people of all age groups are attending one gym trainer, and he's doing the same thing for everybody. It's not meant for everybody. And you could land up into a problem. So that is what I say, you do what is suitable to you, consult a doctor, get a physio, and take those exercises and do it regularly. With your diet is extremely important. We tend to binge on, there's a lovely book by Neil Barnard, who wrote on the seduction of food. And this was the book written, it was a bestseller. When Bill Clinton had a big problem, He landed with the bypass surgery, and he followed this diet. And this is a book I think everybody I would recommend read, how we get enslaved to our food, the food that we eat, and the chocolates, the junk food, the preservatives in the food. It's very important that you buy your own vegetables, don't leave it to your servants. This is what we are going to eat. And salt intake has to be reduced. At this age, in the menopause woman, salt and sugar is reduced, you have crossed very well your life. I can tell you that. So binging on wafers, on Lays or whatever you call them there in the market stores, please be very, very careful, especially if you are hypertensive. You are in trouble.
What is the name of the book you referred?
Neil Bernard, Seduction of Food. It's a lovely book. It's a readable book. Of course, everything is not applicable to us because we don't, simple thing like oats is the ideal thing to have breakfast. And how he explains that children, when they don't like oats, you make something different. Now, you all ladies know better than me what to make something good for them, which is palatable. But you have to give them nutritious food. And preservatives, definitely avoid. And please, whenever you buy your packages, please turn behind and see the calorie content and the salt and the sugar content. If you talk to any of your dietitians, and you must visit your dietitians and see what they advise, they give you a more scientific and correct advice. So prevention is better than cure.
So can you spell the author, Dr. Neil Bernard?
But Neil Bernard. Yeah, I'll just see the book name. One second. Is Neal Bernard, Barnard. The title of the book is Breaking the Food Seduction.
Okay.
He talks about the power of your plate.
Preeti, just go ahead.
Yeah, okay. Hi, doctor. Thank you
Hi.
for the lovely sessions. I have a question for periods cramp. So general GP normally suggests cyclopram for girls and all periods. And kids are taking 2 pills every month, 2 to 3 pills. So how this, can you suggest anything else that they stop taking cyclopram or anything else? Should they go for a gynec test or something?
No, the period cramps are quite routinely felt. It all depends on the degree of the period cramps. Sometimes they are mild, you can get over with it. Sometimes they're quite severe, you require a medication. It's not necessary that every month you go on taking it, you see accordingly. At the same time, visit your doctor. Depends if you're a senior person or an older. Generally, the younger ones get it and not the senior because the uterus is already expelled. Sometimes there could be a malformation in the uterus, which does not allow the blood to come out properly, and the uterus contracts and causes severe pain. So I'd advise is basically you prevent the pelvic congestion of the blood, and that is by encouraging the children to go out and play some sports, play some games. So you're not sitting in one place and congesting the pelvis, which is one of the causative factors of severe period pains. So you have to take Comifla. I mean, the painkillers are very dangerous to take, I would say. I would not recommend anybody, but sometimes you have to give those painkillers because it hampers your quality of life and your day-to-day working. So your doctors will prescribe, but it's not a matter of routine.
Preeti, you're on mute.
Sorry. So actually, so it's not advisable to take cyclopam in basically.
Cyclopam you can take when necessary. See, everything taken in moderation is fine. Each drug is beneficial. If taken beyond, can be problematic. So when you find that your work is hampered or the child can't go to school, are you missing classes, or it's upsetting you very much, and it really disturbs your daily life, then you must take it.
Okay.
But again, those period pains are just few days before the period. It's not that you take it for a month or so. You take for a few days before the period starts, and then once the flow starts, everything generally tends to be normal.
Okay. Thank you, doctor.
Doctor, nowadays we're seeing a lot of children with very early puberty, by 11 and, 10 years. So, it happens, and after that, there isn't much to do, but any specific care, concern, or it just takes the normal course after
See,
that?
when they reach early puberty, it's very important that they are in your loop. Parents should be around to give them confidence. I find in the recent type of the children which we see, these children, mothers come to us and say, this child doesn't listen to me at all. She avoids me or she gets angry. They feel the mother is interfering. That should not be the attitude. The mother should be a good friend. Talk to her, take her into confidence because you know what's happening in the child's mind. And we are exposed to so much of data from outside. And you find that we are getting so much of information that they are tending to get wiser and better than our generation. And what was your question, please? What was your question?
Is there any specific extra caution or care, as compared to otherwise? Will they be
You have to explain to the
impact on
child about
development, on growth? So just broadly, is there any other implication?
Yeah. See, in this growing age, they are very inquisitive children. They are very curious children. And it's very important that we raise them in a proper manner. So you must have table discussions with the children to talk to them about, especially things like, we condition the child when it's a toddler. When a child touches the genitalia, we hit there and say, dirty. It is not dirty, it's a part of your body. So that conditioning goes into the child's mind that this area is dirty. It is not true. So this type of language and the words which we use to the child is very important. Take some pictorial pictures or diagrams or whatever. There are lovely bookstores which have good books on educative matter, which can pictorially explain to the child at that point of time the body development, what are the changes takes place in your appearances, self-esteem. So give them that sort of a confidence so that they understand that this is a normal process. For example, sexuality. Most important, parents have to be more comfortable with their sexuality when they talk to them. And this would apply to the girls. I think the most important part is talk to the boys. There's no point at that point of puberty that you neglect the boys completely. They have to be very much in the loop and made to understand their physical development and their behavior and respect towards a woman. And that respect has to be ingrained in them, that it has to come to whether it's your sister, whether it's your daughter, whether it's a friend or a college girlfriend, whatever it is, you have to respect the person. And then only things will develop better. Otherwise, there'll be a constant worry in the parents' mind where my daughter is going, what she's doing. So this type of thought should be ingrained in them. So for example, you hear these talks on the TV or whatever, that touching, the good touch and a bad touch. There's nothing like a good touch or a bad touch. The word used is appropriate touch or an inappropriate touch. That has to be explained to the child at this time of puberty. And when people talk to you, how the behavior and the body language has to be explained in a very nice, simple way. So they don't get wrong ideas about what you're trying to tell.
Doctor, does early menstruation affect growth?
At what age you mean early?
Early meaning 10, 11.
Average is a human biological clock. So 11 to 12 years of age is the time when they get the period. Sometimes they get it earlier also. But when they get too early, we call them precocious puberty.
Yeah.
Yeah. When they are very too early, say about 7, 8, or 9, they have the full secondary development of their hormones and everything. That is the thing to think about it by the doctor.
Can it be postponed?
One should not try to interfere with the natural clock. Let it, because you're setting itself. The hormones that see at puberty, all the hormones are coming to play. The estrogen, the progesterone, the growth hormone, and the overall development of the person is taking place dramatically at that time. So why should you interfere with nature? Let it grow. There will be some irregularity, there will be some teething problems. But thereafter, it settles down. When it doesn't settle down after a few years, then you have to visit.
But does it affect, supposing, the height or the general growth of the child? Early menstruation.
No, I don't think so. Doesn't affect. It's a height and all that depends upon your nutrition, your diet, and a genetic predisposition.
Thank you.
Thank you.
Okay, if there are no other points, then I would like to thank you, Dr. Gokral. Thanks a lot for this
Thank you very much.
about an hour session and spending this time with all the interested people. It was a very good session for all of us. Thanks a lot. Thanks
Thank
a
you
lot.
so much. Thank you. Thank you very much. Thank you.
Yeah.
Thank you, Doctor. Thank you very much.
Welcome.
Thanks, Dr. Sudhir.
Thanks, Anil, for organizing these
Thank
nights.
you.